Hello and welcome to Healthcare Voices, where we bring you authentic voices behind healthcare innovation and impact. I'm your host, Katherine Cummings, former clinician turned healthcare technology advocate, and today I have the privilege of speaking with Kian Saneii, CEO of award-winning care platform Independa. Kian is an expert in technologies that engage older adults, and he's also an advocate for approaching care in a more person-centric approach. I'm so excited to speak with him today. Thank you so much for joining me, Kian. I know you're traveling right now, so thank you and welcome.
It's my pleasure. It's always great to chat with you, and I'm really looking forward to our conversation today.
So, I would love for us to start off with a question around person-centric versus patient-centric care. And as a former clinician who kind of went into healthcare with the goal of being a patient advocate, I love that idea of really focusing on the person instead of kind of the patient, right? Can you explain to our listeners the difference in those two approaches and why person-centric care is kind of the ideal care model?
You bet. It's really not just semantics. In the past, you had these big ivory towers of data and spaces like a hospital, let's say, or Epic or Cerner backend system for patient data. And there was a lot of effort around, well, let's not just deal with the staff members and the doctors and the nurses and the radiologists and so forth. Let's open some of that up to the patient. So a big step forward from that world, the ivory tower world, was to make things patient-centric. And that was a big step forward and everybody was happy. But the reality is we're not really patients. Nobody wants to be a patient. Even if you have to be a patient, you're a patient hopefully for very little span of your life. Maybe when you're visiting your provider, and maybe if you're recovering in your home. So most of the time we're people. And so a person-centric approach to care means you go to where the data source is, which is the person. And from a security and management standpoint, the data is yours, not the ivory tower providers, not necessarily Epic or Cerner or the hospital or the doctors. And then you get to share that data with the different providers that you have. So that gives you a lot more flexibility. And also from a security standpoint, you get protected, you're managing your own data. But more importantly, also, it's not about, at that point, codes and billable episodes and so forth. It's about your normal daily routine of being healthy and well. And if you do that, then you're a patient a lot less, which is what we all want to be. So it's more than semantic. It's really about being a person, living your life in a healthy and well way, and then being able to share that data with the providers as needed versus being able to access your data as a patient.
I love the idea of the patients kind of holding ownership of their own data instead of having to, go through the red tape of going into the system and having to deal with all of the challenges with interoperability there. How do you see the role of technology kind of evolving over the next decade to address maybe the increasing healthcare costs as well as increasing complexity of care?
Sure. So there's really two ways technology will help. One way is that we have such a, let's just say challenged, but maybe more accurate way is a broken sick care system, that there's so much room for efficiency in the system as it is. Most people know we're now approaching $4 trillion of healthcare spend. Generally, it's well known that about $1 trillion of it, which is not a trivial number, is wasted. And when we say wasted, everybody says, oh, great, let's get rid of the waste. We can't get rid of the waste because it's profits for companies and it's profits for the institutions. And it's part of how we bill. It's part of how we manage. It's part of how we provide incentives and provide, there's a better word I'm looking for. I'll come back to it. But all of that together creates that waste. So how do we create efficiencies there? So as an example, we're all acknowledging that the person, including the patient, goes home at some point. Hopefully, they're not going to be in a hospital or long-term care forever. And so when they go home, healthcare is following them home. And the systems that are doing that more and more are areas like ACOs and hospital readmission penalties. Anytime you hear capitated payments, value-based payments, managed care, Big time of that is PACE programs, for instance, special need programs. Medicare Advantage is another one. All of those are aligned with the person's value, which is, I want to be where I am currently. I want to delay or possibly prevent the next episode or stage of care. I said that more slowly for effect. So that's what we all want to be. We all want to be where we are. We don't want to have the next episode or stage of care. And the models that support that can and should and do use technology to do that, in a better and better way. So an example is, how do I have visibility to you from a distance without you having to necessarily buy new things, pay medical, prices for them? So you can basically use consumer devices like your TV, your tablet, your computer, consumer type products like maybe a scale you can buy from Amazon or Rite Aid, and have remote monitoring of you in a passive way. So you don't have to learn anything new and do anything new. But yet, if something is triggered, so if some exception hits, then the right people are notified. That's a good example of something that's not for only 30 days, let's say post-op, or 60 days, but for the rest of my life. But the right people get notified. And the right people, by the way, may be my daughter, maybe my son, maybe my neighbor, maybe my friend. It doesn't have to be an expensive doctor. If I just need to have somebody remind me I need to step on a scale every day, and 3 days have passed. So those are examples where technology, if it's pervasive and simple and engaging, could be both holistic and also very effective.
There's this general notion that I haven't yet addressed kind of head on in this podcast, which is the notion that our healthcare system as it is kind of broken. And I think prior to this podcast, we were discussing some of the, I guess, mind-boggling statistics, I would say, around the cost of care, as well as the fact that healthcare is a business. I'd love for you to share some of those statistics with us and share how they're really impacting this kind of notion of brokenness in our healthcare system.
Sure. So we're all consumers of healthcare. So for all of us, we need to be mindful of why the system is the way it is. Let's just start with, there's no particular order, but let's think about pharma. Big pharma used to be 15% of our healthcare costs. It's now approaching 50%. So just think about that. 50% of our healthcare costs are going to medications, basically. Another area which we're all familiar with is roughly 80% of the costs are in chronic condition management. And wouldn't it be easier, wouldn't it be better, wouldn't it be wonderful if we can actually reduce that number by just keeping people healthy? By the time you have either a chronic condition or some sort of comorbidity, it's really hard to manage that. So why don't we do that? Well, we don't do that because institutions that get paid on episode are not incentive to never have you come back. By the way, the word I was looking for is motivated. Everyone is motivated, right? To be, if I'm a doctor and I have a mortgage and I want to send my kids to school and I paid all that money for my education and I owe, debt and all that, and I can make money when you come in, I must make money when you come in. That's the whole system. Then I'm not going to spend half my day trying to keep you away. Now, if you come in, then if I'm really good at what I do and I care about you a lot, I don't want to see you again, hopefully, and I want to fix you in a way that you don't have to come back. But there's no incentive for me to go spend time and energy doing that. I'll give you more numbers and sort of mind-boggling statistics. Even in a capitated system, let's say half of a hospital might be on a population health is another area. I don't think I mentioned that term, but that's very much aligned where, hey, if I'm doing risk-assessed coverage of people, I don't want to see them again. I want to keep them where they are. They're happy, I'm happy. So let's say a hospital has 50% of their revenue in population health. They still are not incented to keep the whole population away from the hospital because those beds have to get filled. Here's another, it's not a statistic, but just common sense. If I'm building a new hospital and I get up on the podium and I'm selling bonds to investors, my pitch is not, if you help me build this new Taj Mahal, and I have a few wealthy people call buildings their names and all that, and I also have bondholders and all, I'm going to keep these beds empty. The whole place, no one's going to be walking around because I'm going to do such a great job. Everyone's going to stay in their homes. So I can't even pay the investors back. I pay the investors back by actually filling the system, saying, I have these specialists, I'm going to do these kinds of very expensive surgeries, I'm going to get this kind of money back from doctors and specialists and so forth, and I'm going to make a lot of money, I'm going to pay you back. So the whole system is, of course, based on money. And of course, everyone says it's on health. We know that it's on health. Nobody wants to do anything bad. Everyone's, following the Hippocratic Oath. But we are incenting the whole system to do that. And so it's incumbent on us to look at that and say, what other models are there, like population health, like Medicare Advantage, like maybe a single payer system that allows them to be aligned with us, you and I as consumers, which is staying at home and doing healthy things up front.
So you kind of answered my next question a little bit, but I'd love to get a little bit more insight from you into what you believe some of the actionable things are to kind of fix what's broken, and how do you think we can redefine healthcare other than just kind of moving a couple of things to home? I know that you're an expert here, so I'd love to hear your opinion on this.
So I think it's really just common sense, health and wellness. This could be a whole day long podcast that will chat about things like food subsidies and use of corn syrup and incenting food companies to do better for us and so forth, not feeding kids sugar and grade school and candy and vending machines. All of that kind of adds up to areas like obesity and blood pressure issues, and then you end up with diabetes and heart issues and lung issues and COPD and all of that. So all these are interrelated, but just sticking to sort of the after effect of all that, we all want to be where we are, which is in the home. And so how do we make the home a healthy and well placed? One is to not have to require, and one of the statistics from your last question is 50% roughly of our healthcare costs is in the last year of life. So just let's think about that. For me, and on average, 50% of what the system pays for me is based on whatever life I have left at the very end of my life, the last 12 months. So how do we make those 12 months both more comfortable and what they call health span, not just lifespan? So lifespan is a quantitative thing. Health span is a qualitative thing. We want to stay healthy. So, for instance, what if, and us, we were innovators and still are in using the television as an example and as an option to bring health and wellness to the home. The screen is a big device. You can engage with your doctor in a different way. They can see you in a different way. You don't have to learn anything new. You don't have to buy a new device. Another area is, what if we can bring exercises to people? And what if we can address, if we're talking about older adults, which is a big part of our cost, obviously, when we talked about chronic conditions, last year of life. What if that person just had the car keys taken away? What does that mean for them in terms of the social circle? Now, more recently, we've all heard SDOH, social determinants of health. There's another term being used, healthy days. These are all clinically proven to actually reduce costs, reduce anguish, and improve quality of life in people that can be socially engaged. So if I just took someone's car keys away, I'm collapsing their social circle. What can I do for them that might make some of that up? If they can't go to church anymore, if their friends can't visit them as much, if some of their friends are passing away, their kids are far, they're maybe in a rural area, half the time they can't travel anyway because of storms and whatnot. So what if the world can come to them? What if a trainer could be on their TV and help them do exercises every day in a very cost-effective way for $5 a month, let's say, instead of going out to a gym and hiring a trainer? What if information from WebMD is available to them in a peer-reviewed medical grade way that they can look at the categories that are interesting to them and get content delivered right there on their TV, by the way, or on their computer or tablet, and be able to get educated about the operation that they're about to have? What do they do that's healthier before they go in? What do they do after they come home? What if they can learn about technology free? What if they can get a pharmacy discount card? These are all things that, if we get a chance to talk about Independa, they're all built into the Independa Health Hub. And it's all about, how do I bring technology in a pervasive, simple way so you can engage with the world can engage with you, so you can have better care, better education, and remote engagement all in one.
Well, I think that's a perfect lead in to kind of talking about Independa. I know you founded your company in 2009. I'd love to hear more about the founding story and the inspiration behind it, and a little bit more about the company as well.
The company was founded really based on some personal experience. My parents took care of my grandparents on the maternal side, not at the same time. First, my grandfather, and then he passed, and then my grandmother. And without knowing it at the time, I've been in technology my whole life, but without knowing it at the time, later I realized when I was thinking about what to do next, that there were really no tools for them to use in any way that would be helpful to them. So we got into, as Independa, we engaged IDEO. And when I say we, it's me and a mouse in my pocket, I guess. So I engaged IDEO, the design firm, and they did a great job answering two questions. Why hasn't there been success with technology for older adults? And what needs to get done differently to be successful? And really, they came back with, at the end of the day, we even did wireframes of the Independa initial application. But the point was, there has to be a holistic approach, which we started our conversation, Catherine, talking about person-centric versus patient-centric. That's a holistic approach. It's not based on CPT codes or episodic care or silos that we have seen in the past. So if I'm taking care of mom, I don't think about the 10 different things individually. I think about that day. What are the 8 things, 10 things I have to do for mom? What are the things I worry about? So we built the system around mom instead of around codes. Second is, it has to be super, super simple. So, everyone talks about simplicity, but simplicity is really hard to do. It takes energy. It takes, recurring, stopping everything, taking, all the staff and saying, how do we make this process easier? How do we make that thing easier? Always asking customers and surveys and so forth. So those two areas defined Independa: engagement from a distance and simplicity, and bringing a platform that allows someone to not have to learn anything new and bring the world of engagement, health and wellness and care into their homes. And the home could be a senior living group, by the way. So we have all these services for senior living as well as home care and, across the continuum of care.
So, as a follow-up question, what do you think some of the most impactful features of the platform are for not only adults or older adults rather staying in their home, but at these long-term care facilities as well? What do you think? What features are the most prominent or the most impactful?
Sure. At a high level, we provide 4 value pillars: social engagement, which is critical, clinically shown to improve self-care, which is also improving your issues with medication care, medication adherence, which then keeps you from getting into recidivism, into the system, anguish, cost, all that. So social engagement is actually a very clinically proven important aspect. Next is for a senior living group, let's say. We talk about operational engagement. So how do I make the staff and the operations more efficient, more effective? We have a wide range of integrated services. Again, it's about all in one. So you have your menus, your community calendars, your surveys, your broadcast messages, your digital signage. What else? I'm missing something. Oh, your work orders, all of those in one place. So all of them being delivered in a unified way to the end user. And if you have existing applications in those areas, we integrate and collect data from that, so you don't have to duplicate things. And then there's really 3 areas in general. The care recipient, we generically call. So that could be the person, the patient, the member, the participant, the client, you name it. And then the staff, so all the different roles that take care of you. And of course, the informal circle of care. So you download a mobile app or iOS or Android, and family and friends can connect with you free of charge. So it's all about making engagement frictionless. The third area, value pillar, is clinical engagement. So we talked about what happens if I don't step on the scale. What if I stepped on the scale and I gained 10% weight in two days? What if my blood pressure is this and that? So we integrate with health devices as well as other sensors that could help you. Like, what if I go to the bathroom and don't come out for 2 hours? Or I didn't get out of bed, till 2 p.m. today for the first time ever. Who should know about that? So that's clinical engagement. So I catch little things before they become big problems on the health side. And last but not least is the Independa Health Hub, which is a collection of services. And those are the services engagement. So I'll give you an example. I had a really bad toothache a few months back. I woke up. It was just horrible pain. And I had to work through the day, and then I realized it's Friday and I have to go through the weekend with that. Like, what do I do? I'm like, I think I know what to do. So I got on the Independa platform. I did a televisit with the dentist. The gentleman happened to be out of Riverside. I'm in California, so 50 state, 24/7 access. He realized I had an infection. He prescribed antibiotics to the local pharmacy, gave me pain meds too. I didn't need them, but I took the antibiotics and I went through the weekend just fine, actually. And Monday I called my dentist. She said, you don't even have to come in. That's what I would have done. So that's an example, whether you're in senior living, in home care, wherever you are, the services that bring health to you are really important. And by the way, so you might have your doctor, you might have, insurance coverage, but what if you need a second opinion? What if your doctor is 3 hours away? What if it's the weekend? What if you don't want to go in because there's some pandemic going on or some flu going on and you don't want to catch something? We even have in-home lab tests coming to you, so you don't have to go to LabCorp or Quest unless you absolutely have to.
I know that we've spoken several times prior to the podcast about the notion that when older adults are isolated and they don't have that social engagement, it really negatively impacts their overall health and well-being. I'm sure that you have a lot of research to share about the statistics around that. I'd love for you to share a little bit about how your platform is kind of helping enable that social engagement and about how social engagement in general can positively impact well-being and overall health for older adults.
You bet. It's really not a nice to have. Very few of us have experienced the, frankly, horror of not being able to have any kind of human contact for the longest period. A lot of times, if you know an older adult, especially if they live alone, even if they're not watching TV, the TV is on all the time. Just to even be able to hear human voices is better than just walking around in silence. And the impact is profound. You end up into self-neglect. Basically, you get into depression. So social isolation leads to loneliness, which can lead to depression, which leads to self-neglect, as I mentioned, and medication neglect. Now we're sick, and now we have to go back to the system. So I'll just give you, anecdotes that we can all relate to. People call emergency numbers just to have a human contact. They actually go into the ER just to have human contact. I won't mention a name, but a major COPD, basically oxygen tank company. Somebody clever in there figured out they can do less truck rolls and have a new system that they didn't have to collect and replace the oxygen tanks as often. And that was good for them, and they thought it was good for the customers. They started losing customers. And the reason was, in many cases, the customer, the only human contact they had was this person that came into their home and replaced their oxygen tank every couple of weeks. So just imagine that kind of a life. Of course, I'm going to be depressed. Of course, I'm not going to be as well as I can. So that's the negative of it. How do you apply technology in a simple way? Well, almost everyone knows how to use a TV. And so that's a platform of choice for us because of the size of the screen, the simplicity of use where you consume it differently. You sit at a distance, comfortable like you always have been. And imagine just getting a call on there. It's your daughter. You can have a video chat with them. And oftentimes you have the TV on blast for so high and so long anyway, you don't even hear the phone calls. So even if you can use your phone, oftentimes people call the neighbor, can you please knock on mom's door because she hasn't been picking up. So that's one simple way. Then you add things like sharing photos, sharing messages, little Billy's soccer clip that you just scored a soccer goal. Maybe Arthur scores a soccer goal. And then you share that and send it to grandma. And now she's a part of that life. Or you have life stories, so you can capture someone's life in audio files, so you can share that with family members. So now suddenly you're being heard, you're being engaged, and you didn't have to go buy a tablet. You didn't have to go learn passwords and virus scans and software updates to be able to do that. So I think that's really profound, just from a social engagement standpoint. We also have games, by the way, that help with your just spending time and engaging with the system, but also helping with the cognitive areas like word games and puzzles and so forth, memory games.
Perfect. Thank you for sharing that. I think that's one of the most profoundly impactful parts of your platform. And I think, having parents who are older, I think the social interaction is so important. especially when they are isolating themselves, right, by not interacting as much. I've spoken to several guests about on the podcast about artificial intelligence, and I would love to get a little bit more insight from you for how you think artificial intelligence is going to impact healthcare. I understand that there's a lot of physicians that are kind of looking forward to the time when AI simplifies charting so they have more time to spend with their patients. But what are some of the trends that you're seeing with AI?
Yeah, so I think that's both a great question and a topical question. Obviously, everything is AI centric right now. I think really when technology like AI finds its way into the common areas of both technology and just society, it's going to disappear, right? At some point, it's going to be sucked into everything that we do. So already some of us are seeing it in different tools that we use. So if you use Microsoft Word, it summarizes things automatically. Or if we're on these types of podcasts, there's an AI chatbot in the background taking notes for us. So the doctors who are excited about the note taking being more automated, more power to them. I agree 100%, but I think that's just like the tip of the iceberg. I think what's going to happen is if you and I look forward in, maybe even just 2 or 3 years, imagine having a system where you could just simply ask questions and the system guides you through possibilities of your health issues, maybe, as well as your health plan. AI is nothing new. I think Meyer Foods started it initially with just figuring out what to put in what shelves, so you sell more. That's all sort of large language model equivalent, but in retail. And then Walmart took that and did a great job with it. Then Amazon took it from Walmart, did a great job with it. So we've been using AI as consumers, or at least companies have. But now that it's in our hands, why not have, an AI? I can't say doctor. I don't think the AMA would ever be happy with that. But why not have an AI, let's say, care assistant, care concierge, that you can ask and have a conversation with, maybe with an avatar, and be guided through your issues. So there's a lot there, and I think it's just going to get sucked into all the different ways that we use technology. It's going to be in our cars. It's going to be in the conversations that we have. It's going to help with social engagement. We talked about that. What if I can talk to my AI bot that has a face and has an avatar and gets to know me and treats me like any other human being? That's all coming. So I think it's going to be fantastic, but it's much more than taking notes.
I like the idea of that kind of virtual care assistant. I think a big complaint that I hear from a lot of the physicians that I know is that they can't even spend enough time with their patients to be able to do that education with them. They're limited to a 10 to 15-minute appointment, and they rely on a lot of other people on their care team to make a care plan for the patients, assist them with that transitional care from the acute to the non-acute setting or to home. And there's a lot of things being juggled and a lot of, I think, patients that get lost in the shuffle because there isn't that, continuous maintenance that's happening with care. And that care assistant, I think, could probably alleviate a lot of those challenges.
Yeah, yeah, and we have labor costs, right? So we have McDonald's and others are using AI, to take orders right now. In fact, a few of them, they had to shut down just recently. It's very recent, like yesterday. They shut down a bunch of the ones that were doing it because they were giving the wrong orders, but others are using them successfully. So in every way, we have radiologists that have been, I don't want to say replaced, but you can find, it's proven, the expert system actually finds issues in your x-ray better than a radiologist, just because it's just patterns and it knows patterns without having to see it the way we do. So I think that's all coming. And in this case, I think just having a social companion, the value of that is huge. And we can't afford to necessarily have that person. We can't afford to hire that person for mom. But what if for 1/100th of the price, we can have, the equivalent of someone who's caring, or maybe we want to make them funny instead of just caring, whatever we want. And the system gets to have a conversation and a relationship with mom. I think that'll be awesome.
So I'm going to end the podcast with one last question. What's one bit of knowledge that you'd like to impart on our listeners today?
One bit of knowledge. I guess, we've sort of touched on the challenges of our current healthcare system and how people get paid and so forth. So some of the results of that are, I would say, and doctors tell me this, whatever way we can, we should avoid getting to the hospital. I mean, part of it is just staying healthy and not having issues. The other one is like, even if you have issues, if you can go to maybe urgent care instead of a hospital, emergency room, maybe seeing a doctor in a clinic instead of a hospital. Every time, I talk to doctors who are in hospitals, everyone recommends just stay away as much as you can. Having said that, I have a family member. She had horrific, cancer, stage 4, and she was in Cedars-Sinai for probably 2 months. And that hospital saved her life. So I know that it's when you need it, there's nothing else like it. You can't do that, with an independent system on a TV. But if we can avoid it, it's the best advice I've heard. Just stay healthy, and whatever you can, stay away from the hospital.
Thank you so much, Kian, for sharing your experience and your expertise. You're clearly very passionate about what you do, and it's been an absolute pleasure to have you on the podcast.
My pleasure, Catherine. Thank you for doing these. It's great to be a part of it with you.
Thank you to all of our listeners for tuning into the podcast today. We appreciate your support. To hear from more healthcare voices like Kian, share this podcast with your friends and family. I'm your host, Catherine Cummings, and you just listened to Healthcare Voices.